Hello. So I wanted to do a quick video about why COVID-19 is affecting the Black and Asian community more than it is the white British population. So there's been a lot of misinformation going around, a lot of facts, non-facts. So I thought I'd do some research and give you the information that you need. So I took most of my statistics from the Office of National Statistics, Diabetes UK and the British Heart Foundation. So I looked into why Black and Asians are more likely to firstly catch the infection and why they're more likely to die from the infection. I looked at 4 factors. The first one is socio-economic status. So this is primarily linked to your occupation and the income that's coming into your household. Black, Pakistani and Bangladeshi households are more likely to work in an occupation that's in healthcare and in transport. These occupations significantly increase your risk of catching COVID because you're working face to face with the public for long periods of extended time. The second factor I looked into was living arrangements. So we've seen that COVID is more likely to spread in highly dense urban areas. These are the areas that Black and Asians are more likely to live in. So that's Birmingham, Wolverhampton, London, Manchester, Leeds. Not only that, if you look at living arrangements in terms of overcrowding in households, we know that 2% of white British households are overcrowded, compared to 12% in the Black community and 46% in the Pakistani and Bangladeshi community. If you live in an overcrowded house, you're more likely to pass infection to your family members. Third factor is current health condition. So we know that COVID-19 is more likely to kill those who have a pre-existing medical condition and who have poor health. If you're a member of the South Asian community, you're 6 times more likely to have type 2 diabetes or high blood pressure. If you're Black, you're 3 times more likely to have high blood pressure or type 2 diabetes than the white British population. We know that 62% of the British population is overweight. 72% of the Black British population is currently obese and overweight. This increases your risk of dying from COVID-19. We know that Black and Asian minority ethnics are more likely to be vitamin D deficient, and we know that vitamin D is integral to your immune system being able to function to its potential and being able to fight off disease. So, you know, Black and Asians need sort of 2 to 3 hours of sunlight a day. That's something that we don't get in the UK. Sunlight is the primary source of getting your vitamin D. So if you can't get that, buy some vitamin D tablets, take them daily throughout the year. The third factor I looked into was access to fully resourced healthcare. So we know that if your health clinics and hospitals are under-resourced and they're over capacity, you're less likely to get the treatment that you need. You're more likely to wait for the resource and treatment and the healthcare professionals to see you. So you're more likely to catch the infection and you're more likely to die from the infection. Areas with under-resourced health clinics and hospitals are highly populated with Black and Asian minority ethnic groups. So this kind of socio-economic background goes hand in hand with race. We also know that those from Black and Asian minority backgrounds are less likely to have more extensive treatment from healthcare professionals and they're more likely to be sent home or turned away. So what else does this tell us? So this tells us that it's really important for us to vote when elections come round. We need a government that will invest into our communities, invest into our healthcares, into our educational institutions. Our government has a budget's given to our councils and they redistribute as they see fit. So we need people from our communities in leadership positions. So that means encouraging people of any age to get involved in being involved with the council, becoming MPs and representing us. There's some things that we can't do. I mean, we can lobby the government, we can petition for more resource, for better funding in our communities, but those things are quite strategic, they take time, and time is something that COVID-19 will not allow us. So there's very few things that we can take into our hands. But one of the things that I am a massive advocate on is improving your health to the best that you can with the income that you've got. Make sure that we're getting enough sleep. Sleep deprivation is linked to poor immune function. So if our immunes are not functioning properly, we're more susceptible to infections, to disease. So I hope that information has helped. I think knowledge is power. I think the more that we know, the better that we can handle this situation in our own communities. So in our households, if you do live in an overcrowded household, what measures can we put in place if someone is showing symptoms? Getting them to use their own cutlery, thoroughly cleaning the bath with disinfectant, Dettol, that kind of thing. I'm sure we all know that, but it's kind of those small changes that have a big impact. Safeguarding our communities, looking out for each other, communicating with each other, giving to food banks, doing what we can, checking in on the elderly in your community and those who are vulnerable, really trying to work together. It's a really hard time, but I'm hoping that we can unite, use this information and move forward in just fighting this disease and getting through this. So thanks for listening. Peace.